All right. Good morning, everybody. Today we have Portland Veterinary Medical Association to talk about their journey to become a veterinarian and a vet tech. But before that, let's do a little check-in. As you know, you have to check in so that your teachers know that you're here. And if you have questions, this is a great question documents that you can reference to. And this is the evaluation form. This is how we give you attendance and credit for attending this event. Be fully present, pay attention. This is a good time to ask questions if it's the career that you want to be in. And again, submit your evaluation. This is very important. This is how we give you attendance again and your credit. And it's a requirement for you to graduate in Oregon in high school. And that is it for me. Let's have Dr. Thompson and Rachel Beck.
Hi. Rachel, did you want to go first or do you want me to go first?
You go for it.
Okay. Hi, I am Dr. Jessica Thompson. I'm a veterinarian at Vista Pet Hospital. I graduated from Oregon State College of Vet Med in 2009. My undergraduate, a little bit about me. I grew up outside of Eugene in Pleasant Hill, a little town. And my career kind of started as doing 4-H and working with a lot of animals. I did small animals, so rabbits, guinea pigs, and ducks, and things like that. And then as time went on, I got more interested in other things and graduated high school, went to Bend, did community college because I wanted to save some money, and worked in veterinary practices over there, and then got into vet school after that. Excuse me. And I love being a veterinarian. Not only do I get to work with pets all day, I really love the science behind it. It's a very science-based career. And it's always like trying to figure out what is wrong with an animal. So like, for example, pets will come in with non-descriptive conditions like vomiting or diarrhea, and then I get to kind of figure out why that's happening. And so it's a really cool, unique thing to do every single day. And I also really love working, with pets and their people. And it's just a great career. I've been in small animal, I guess 2009 would be almost 13 years. Am I doing the math right? And there's lots of career opportunities. You don't have to work in general medicine. You can go and specialize like in internal medicine or surgery. I really do enjoy surgery. So as a general practitioner, I can still do a lot of surgery. And if we have time, I can kind of show you guys what's going on in the back of the hospital because I'm working today. I also do a lot of rescue work. I'm a board member on 2 rescue, Northwest Animal Companions and Shelby's Safe House. And I get to foster a lot of kittens and, help them a lot. And that's really great too. Rachel, you want to go about you?
Yeah, definitely. Thanks, Jessica. I'm Rachel Beck. So I'm a certified veterinary technician. I've worked in the veterinary industry for over 20 years now. I started as part-time receptionist. I was young. I wasn't really sure what I wanted to do. I'd always really loved animals, but really wasn't sure how to get involved. And I had a friend who started working as a receptionist at a veterinary clinic, and I got a job there as well. And I absolutely fell in love. Just really felt like this is the right place for me. it can be fast paced. There's so many pets in the world that need care. So that was really exciting. You get to work with a lot of interesting people, a lot of clients, and really get to know them and their pets. So I did that for a couple of years, and then I really started to hone my more clinical skills. So started working as a veterinary assistant, and then became credentialed as a veterinary technician. And so as a veterinary technician, you get to do a lot of the hands-on stuff with pets. So that can be anything from giving injections or giving fluid therapy to monitoring anesthesia and recovery, taking X-rays, doing ultrasounds, all of those sorts of things. So it's very hands-on with the pets, and it's also hands-on with the clients as well, because they're the primary caregivers of those pets. So ensuring that they know what they need to do to really care for those for their pets. After a couple of years as a veterinary technician, I moved into a practice manager role. So in that role, it's leading the hospital team. So leading the veterinary assistants, the technicians, as well as the receptionists. And then over the years, I've moved into Banfield Pet Hospital's headquarters. So as Dr. Thompson said, there's a lot that you can do in veterinary medicine, both as a veterinarian as well as a technician. And a lot of it's that hands-on clinical work and practice, but there are other opportunities within the industry to work in different areas, such as pharmaceuticals or medical equipment, or working for one of the larger veterinary hospital groups like I do. So there's a lot of folks that are doing the hands-on, but then there's also those other opportunities for folks that are looking for something a little different. So there's just so much to offer, I would say, within the veterinary industry.
So I'm not on a computer, so I have to kind of look at the chat. So the question is, what is a day to work like? For me, since I'm in clinical practice in general medicine, there's my day is variable. I work 40 to 45 hours a week, and I come to work. I either know if I'm on surgery or on exam rooms, and in regards to surgery, I'm either doing dentals, which they're under anesthesia for that, or I'm doing sterile procedures. We have a lot of staff here at our work, at our hospital, and so it's really great. Regardless, I'll have enough support staff, which is like what Rachel was saying, there's from starting as a receptionist, and that was my first job at the veterinary hospital. Way back when I was still in high school, I worked as a receptionist at Banfield in Eugene, all the way to moving to a vet assistant. I didn't become a CVT because I was hell-bent on becoming a veterinarian. But I cannot do my job without my receptionist, my vet assistants, and my CVT. My CVT at our hospital is amazing. She induces our anesthetic events for our sterile procedures, and she can get those IV catheters when I cannot. There's so many jobs that are vital, but if I'm like today, I'm on exams. So I come in at 8:30 and I have appointments all the way until the lunch hour. And usually my appointments are about 20 to 30 minutes, depending on what their conditions are. I have 2 vet assistants that are helping me. So that way they're alternating, but I'm the only one seeing those. And then after lunch, because it's very important for your well-being to have lunch, I come back and then I do appointments from like 2 to about 6:20. And all along the way, I have those 2 support staffs that are helping me get all of my notes done, helping me take care of my patients. When I'm on surgery, I come in at 8 a.m. and I do sterile procedures from 8 until about 1, or dentals from 8 until about 1. And so the first thing that I do is I come in, I go to the computer and look at the history of my patients, and then I go and do all of my examinations on all of them, come up with medications that I want to give them. For anesthesia, they have to get several different medications in order to prepare them to go under gas anesthesia, because it's very critical that you're safe, because we don't want to lose anyone's pet for any means. And then I kind of go from there, come up with the numbering system for who I want to go first and what kind of my plan is. And then on those days, some of the days I have half days, because I'll work 3 8-to-7s and 2 8-to-1s. I really like that, so I can have some afternoons off, which is really nice for life. And then I have the weekends off, which is great too. And then on the days that I have surgeries in the morning and appointments in the afternoons, appointments usually start around 2. So yeah, that's kind of what my day is. At the end of the day, I try and finish up my notes along the way, try and call about lab work and things like that. It kind of varies with what my time frame is, but I have a really great vet assistant that will call some of my labs back for me. So that's really nice too. But along the way, if I need help, like with X-rays, which I have some X-rays and things that we can show you guys if we have time. Again, my CVT and vet assistants are 100% what help my day go. So it's really nice to have them around.
Yeah, and I would say Dr. Thompson very much hit on it. Veterinary medicine is a team sport. It's something where it really is that team collaborating together to ensure that each pet gets the care they need. So as a veterinary technician, we're kind of doing the flip side. We're preparing those pets throughout the day for the veterinarian to be able to diagnose and prescribe treatment and perform surgery. So a day in the life of a veterinary technician, pets are usually dropped off for surgery in the morning. They're drawing the blood, they're running the blood work, they're putting that catheter in, really getting that pet ready. So when the doctor is ready to look at the pet, they're able to make their assessment, get the pet pre-medicated for the procedure, like Dr. Thompson said. In Oregon, if you're a licensed technician, you can put the pet under anesthesia, so what we call induction and intubation, and then the technician typically monitors anesthesia. So you're watching the pet hands-on at all times, monitoring that heart rate. You're looking at that ECG, so watching how the heart is doing. You're looking at how the pet's breathing. There's several different monitors and things that the pet is hooked up to, and so you're ensuring that the pet is doing well under anesthesia. If it's a sterile procedure, the doctor's performing that. If it's something like a dental cleaning, then a lot of times it's the technician who's actually cleaning those teeth. That was always one of my favorite parts of my job in the hospital. It's very, very satisfying taking that mouth that hasn't had a dental cleaning before or hasn't had one in a long time, and being able to get all of that tartar, all that calculus off of those teeth, and send a pet home feeling really, really good. Dentistry is a big part of general practice and preventive medicine. So that was always one of my big interests, since pets don't always get their teeth brushed every day. Ensuring that they're getting their teeth cleaned is really important, and that can be a really fun part of a technician's job as well. And then when not supporting surgery, technicians are supporting those exam rooms. So just like Dr. Thompson was saying, the pets are coming in for all sorts of different reasons. So the technician is helping support the doctor. They're running diagnostic tests. They're getting medications pulled up. They're performing treatments, and just really is a strong partnership between the doctor and the technician, as well as the rest of the team, to ensure that each pet's getting the care that they need each day.
Yes, I 100% agree. It is a team sport and working together, and it almost feels like you're a family, because you see each other every day. And during COVID, this was my family outside of just my home life. And so it's you really build that bond and relationship. And some of my assistants and my CVT can even they know what I'm going to prescribe without me even verbalizing it. So we've got that. In the chat, it says, what's the smallest animal I've done surgery on or placed an IV catheter in? So the smallest animal, we do rats. We do rat spays and neuters. So however big those guys are, I think they're usually about 400 grams. So maybe like a pound, or a little bit smaller. We do a lot of rabbit spays and neuters. We at Vista Pet Hospital, we work with a lot of rescues, which is part of why I love being here. A few years ago, I had to kind of decide what was making me happy, and one of those things was working with rescue animals, and so I really enjoy that kind of work. For placing the smallest animal, placing an IV catheter in, that one is a tiny kitten. We get a lot of neonatal kittens, which are kittens that are under 4 weeks of age. And so I've placed a IV catheter in probably like a 300-gram kitten. So a little under a pound for medication, because they like to get all sorts of different diseases and or really dehydrated. And so it's really nice to have that IV access, so I can give them the medications or fluid therapy. So how about you, Rachel?
Yeah, so I worked with a veterinarian who loved working on those small critters. So we would see all sorts of hamsters and gerbils and rats and mice, and she would perform surgery on them if they needed it. So so I got to learn how to monitor those really tiny pets and learn what's normal for them and their vital signs. A heart rate for a gerbil is very different than a heart rate for a big Labrador retriever. So so that was always really fun. As for the smallest animal putting an IV in, same thing as Dr. Thompson. Those poor little kittens that are really needing support when they're really small and dehydrated. Goodness, putting a catheter in them can be difficult, but it's really the best way that that you can ensure that they're going to get the care that they need.
And sometimes with those little tiny kittens, if you can't get an IV catheter in, they have, you guys know your thigh bone, which is your femur. You can actually put a really large catheter right directly into the inside of the femur and tape that into place to get them some fluid support. So we call that an intraosseous catheter, which we can do as well.
So it looks like a question about experiencing helping a pet give birth. I can say yes, definitely. Both a pet giving a natural birth as well as a C-section. So during a C-section, you have someone who's monitoring that anesthesia. You have the doctor who's performing the procedure, and then you have people who are helping those poor little kittens and puppies come into the world, and warming them up and keeping them safe while their mother is still giving birth to the rest of their siblings. So that's always a really, really amazing experience, I would say. What about you, Dr. Thompson?
I echo that. In my home right now, I have 4 mom cats, and they each have 5 kittens, and then I also have 3 bottle babies. That's a really great question, because on Sunday night, as I'm sleeping on the couch next to the bottle baby, so I don't wake up my significant other, getting up every 2.5 hours to feed them, I hear this loud screaming and some kittens meowing. And I ran upstairs. This cat that I had gotten on Friday, she was giving birth. She was really stressed because she hadn't kind of settled into my home yet. And so she didn't, when they give birth, there's the sac that the kittens are born into, and then there's the placenta, which is what's feeding the kittens when they're in the mom. And so typically the cat will chew the umbilical cord and then eat the placenta. Well, there were 3 kittens in there that she hadn't done that, but she did open the sac, which was good, but they were cold and she was stressed out. And so I had to, quick thinking at 1 a.m., tie off all the umbilical cords, cut the placenta off, and then kind of get her settled into a new space. I have this pop-up kennel that's made for like traveling and for dogs. So I put her in there with a box and then a little cover, and then kind of help settle her down. She started taking care of the kittens, and then I fell asleep in that room next to her, and she gave birth to 2 more. Luckily, she was much less stressed, and so she took care of it herself. I've had several cats that have had issues giving birth, and we call that dystocia, and rushed them to surgery. And like what Rachel was saying, it's kind of fun to get them out of there. And it's another team sport, getting everyone on board to resuscitate the kittens, get them all nice and warm. We rub them, stimulate them because mom is under anesthesia. And we typically have an incubator, which we can put them in, that's temperature controlled and nice and warm. So that way the kittens will survive. And then once mom is awake, she can take care of them again. But sometimes that doesn't happen. Sometimes you have orphans, like I have 3 little orphans, so I get to be their mom. Do we have any other questions? I have a hard time seeing it on my thing.
I'll say, when do you decide that it's time for surgery for like C-section?
So for cats, they're supposed to just be able to give birth, because I mean, we have cats out in stray cats everywhere that are giving birth and not having issues. And so typically you don't expect that. But you can kind of, at 45 days, you can take X-rays and see if the kittens, like count the number of kittens and kind of guess at how far along they are. You can also use an ultrasound to kind of guess the whole gestation period. So the time until they give birth is about 63 to 72 days. So you kind of have a guesstimate of when it's going to happen. Typically, the mom's temperature goes down when they're about to give birth. They don't eat very well, and they just seem really restless with this giant bowling ball in their belly. And if you're noticing the mom like pushing and nothing's coming out, they're really restless, they're upset. Sometimes they try to bite you because they're really uncomfortable and they're just kind of trying to tell you what's going on. That's when it could be, signs that there's issues. It's kind of variable.
What do you wish you knew but didn't when you first contemplated this career?
Do you want to go, Rachel? Or I'm talking a lot, so I'm trying to share.
No, I can go first. I think a lot of people get involved in veterinary medicine because of their love for animals. And I know I did. One of the things that I didn't fully realize until I was really working in a clinic is how much of it is working with people. So like I said about veterinary medicine being a team sport, it's you're really relying on your coworkers. You're also communicating with clients quite often. So you're finding out what's going on with that pet at home and learning the things that you need to so that that pet can get the care they need. And then you're following up with that client, ensuring that that they understand the instructions and what they need to do at home until you see that pet again. So I would say that was one of the pieces where I just thought I would work with animals all day. Didn't really fully think through the fact that that it's such a people-oriented industry, but that's also really great because the reason why the clients are bringing their pets in is because they care about their pets. The reasons why your coworkers are there and they're working with you is because they care about the pets as well. So it's really great to work with people who are really passionate about what you're passionate about. But it also takes those people skills and being able to communicate clearly, having empathy, and really understanding how to collaborate and work as a team, how to work through conflict, how to work through those tough days. There's right now, gosh, the pets are booming. There are so many pets right now that need care, and sometimes there's not enough providers to see all the pets. So it can get really busy, and that can be a little draining. So it's how do you be positive? How do you lean on each other to get through those rougher times? How do you take care of yourself? So making sure, Dr. Thompson mentioned getting a lunch, taking that downtime for yourself, making sure that you're taking care of yourself, you're taking care of your coworkers, because that's only going to help you be better at taking care of those pets that need you.
I agree with everything that you said. For becoming a veterinarian, the biggest thing for me and what I recommend to anyone that wants to become a veterinarian is to start in the hospital and get that experience first, to make sure it is what you want to do. Make sure that this career is something you want to work to, because it was 8 years of schooling. And if you want to go on and specialize, it's many more years. So you want to ensure, you don't want to get to vet school and be like, gosh, this isn't what I want to do, because there's a lot of wasted time there. And if you want to be part of the support staff, you don't really need 4 years of school in order to do that. We have a lot of veterinary assistants that go to technical schools like Carrington College, and then they spend 6 weeks with us, and then we hire them on as a vet assistant, and they learn more skills from there. And then some of them go on to is it PCC has the vet tech program, and then but there's also a lot of online veterinary technician programs. I always like the in-person. I feel like you're just going to learn so much more that way, but both programs are great, especially if you're working in a clinic at the same time. You can get that hands-on experience. But I feel like the way I went to go to vet school really was beneficial, because I worked as a receptionist and then I moved as a vet assistant. And from there, I was like, this is really what I want to do. I was really lucky that I had some great veterinarians that I worked with that were supportive and made sure to show me kind of what the career was. However, times have changed. There's a lot more communication. There's a lot more pet ownership, and we see our pets very differently than I would say that maybe 15, 20 years ago. They're family members. I've always saw my pets as family members, but more and more clients are seeing them that way. And so having the good communication skills and empathy, it's really important in our career, and to be able to support the owners, but also have that well-being for yourself. That's the biggest thing. For many years, I would just work through my lunch or work through breaks and not think about myself, and that's really wearing as well. But luckily, our profession is moving to making sure that we take care of ourselves. So that's why I said I take lunch every day. I try and take a 10-minute break in the morning and in the afternoon, and maybe just go outside if it's not pouring down rain, and go for a walk. Or our building is 2 stories. I'll just walk up the stairs one side and then go down and around and go down, just to get some of those steps in, and to kind of clear my brain, or just walk aside, take a moment if I'm having a difficult conversation, or feeling really emotional about what's going on. Because it's not all happiness, but but it's also not all sadness. I would say it's maybe like 15%. Some things are pretty sad, but the majority is pretty happy. And when you work to help a pet feel so much better, and you see them for that recheck and they're cured or at least managed, which a lot of diseases are just managing the itch or all sorts of different things. You just it's that celebration with the client and the team, and that's great.
Thank you.
Was there another question? Sorry.
Yes, but students, don't be shy to ask questions. You can turn on your camera and just and your microphone. Also, you can just put it in the chat. My next question would be, in your clinic, both clinic, do you offer internship or job shadowing, and how young can they start?
At Vista, we definitely do. We have a lot of clients that they'll reach out and say, "Hey, our kid is interested in becoming a veterinarian or a vet assistant or CVT, which is certified veterinary technician." And we'll basically say, "Well, what's their schedule like?" So we kind of see them more in the summer or during breaks, because we're not open on the weekends, but we're very much happy to have people follow us around and kind of see what's going on or watch surgeries. I think the youngest person I had follow me around was 11, and she wanted to see some surgeries and kind of see what we do because she really wants to be involved.
Yeah, and I would say very similarly, we definitely try to open up and give tours when possible, some observation, especially for those who are interested in going into the industry. Also, certain schools like the PCC Veterinary Technology Program that Dr. Thompson mentioned, there's a certain number of hours that you need to have at least observed in a veterinary clinic. So we make sure that we are letting those applicants come in and experience what veterinary medicine is like, and get those hours within our clinics. So a lot of times it's picking up the phone and calling and just asking, if the hospital is willing and able, and what that might look like. And it's going to be different at each location, but it's a great way to really understand if this is something you really want to commit to and go into. Volunteering also at shelters, rescues is also another way to get a glimpse into veterinary medicine, to see if it's something that you're interested in. So that's another really great way to get involved.
Would you choose this career if you could make the decision again? What, if anything, would you do differently?
Yes. I love my career. I love my job. I love working with pets and people. I don't think I would do anything differently. I love how my career trajectory went, and yeah, if anything, I would have traveled more early on, but that's outside of being a veterinarian. But yeah.
Yeah, I would definitely agree. I can't imagine doing anything else. I feel like I've gotten just so many amazing opportunities to do just really great things that I don't feel like I would have been able to do in any other career. I think that just from a personal note, taking more time for myself. I tend to be a very hard worker, and I just put in my all. I work overtime, like Dr. Thompson was saying, working through lunches, breaks, those sorts of things. And so the only thing I think I would do differently is just be kinder to myself and give myself, those opportunities to recharge. But other than that, I would do it all over again.
What high school classes you have found the most applicable or important for your occupation?
For me, I've always been really into science, and so I I took a lot of science classes, and my high school, I don't know if they do this anymore, but my high school let me go, they paid for a credit for me to go to the community college in Eugene. And so I was a senior in high school, but I was taking college credit classes at the actual college for biology and things like that. If there's communication classes as well as speech classes, because those help you verbalize, those are really important as well. And then you're spending a lot of time writing notes. So being able to form good sentences and being able to explain yourself on paper is really important.
Yeah, I would agree. Definitely science. Math is also another one. So drug calculations, things like that. That's also really important. And then I love what Dr. Thompson said around the other skills around communication, as well as those verbal and written communication skills are really important as well.
What are the most and least rewarding aspects of being a veterinarian and vet tech?
I'm sorry, can you say that again? The rewarding aspects?
The most and least rewarding aspect of being a vet and vet tech.
That's a tough one. Well, most rewarding, I think I've said it before, is success stories. So I say the least are the ones that, aren't success, but that's just tough, because as a veterinarian, and most of us in this career, most people that become in a science-based career are very much perfectionists, and you can kind of beat yourself up. Most of the time, clients don't get too upset if we don't have the best outcome, as long as you're communicating and working through everything with them. And so I would say it's to a certain degree not very rewarding. But then if you, I don't know, I like to be very positive, and so we tried. And we're trying to get there, and I like to set up good expectations. So it would be that, or if someone declines all the services and then they leave and then their pet passes away, I would say that's not very rewarding. But that's few and far between, I guess. I don't know. That's a tough question for least rewarding.
Yeah, I agree. I think that for rewarding, it like Dr. Thompson said, it's those success stories. It's watching a kitten or a puppy grow up and knowing that you had a hand in helping them and ensuring that they were healthy and happy throughout their life. That is super rewarding. Least rewarding, I think it's when you can't, at least for me, because I am a high achiever. I want to do it all. It's when you can't see all the pets. It's when you have to turn clients away. It's when yourself, your team, you just can't take on anymore, and having to say no is always really hard. We're people pleasers a lot of times, and we really care about those pets in need. But at the same time, we're human beings and we have limits. And for all the pets that we're already caring for, to get the quality care that they need, sometimes you have to say no. And so that's always been a hard part for me.
Yes, that's spot on. Having to say no, that you can't see more. Luckily, I'm in a practice where there's 4 of us veterinarians every day. So usually we can try and fit something in, but if they call at 5 p.m. and there's only 2 of us that are closing, we're kind of limited on what we can do and if we can actually provide the best care for that pet.
What is the outlook for this career? Is there a shortage or oversupply of people in this career today?
can start on this one. So unemployment rate for the veterinary industry is under 1%. What that means is that there are more jobs than there are people to do those jobs. So we're very much in this place where we're starting to see a critical shortage of both veterinarians and veterinary technicians, and are very much expecting this to continue. There's a finite number of veterinary schools, number of people that they graduate each year. Veterinary technician schools, there's a lot more, and there's more online programs that are starting to be created. So I'm hoping that will help for at least the technicians. But like Dr. Thompson said, people are starting to view their pets differently over the last couple decades, where they're not just companions or there to perform a service for you. They're your children. And so the demand keeps growing, yet the number of people to care for the pets isn't growing at that same rate. So this is definitely a career where there's plenty of job opportunities. The latest statistic I read was that for a veterinarian graduating college, there were 17 different job offers for each individual person. So this is definitely something where there's a lot of jobs available, and the outlook is really good for folks that are looking to get in this career.
I agree with that. We're always looking for more veterinarians, more assistants. Like right now, we're looking at hiring another vet, which equals hiring probably 3 more assistants, and reception staff, like all of that. We've been looking for a certified vet tech for about a year. So it's the employees get the kind of the pick of what office or practice works best for them, and there's just a lot of opportunity right now.
So during the 2020 and 2021 year, there was a long wait time to get scheduled. I heard like 3 months out, 6 months out. Is it still the same, or have the clinics recovered?
For our hospital, we stopped taking new clients during that time frame because we just couldn't see anymore pets, and we were really trying to take care of the clients that have been our clients for years before that. We just started openings for new clients and new pets to come in. So I would say the average wait at our clinic, based off of like the number of doctors we have, is probably like 2 weeks or so. So like if you call on Monday for an appointment, hopefully we can get you in the following week. But we kind of did this thing where we have urgent appointments on Monday, Tuesday, and Wednesday. So we have a doctor available to see pets that aren't pre-scheduled. So if they're sick, we just fit them in on those days. So that's kind of what we did. The ERs still have really long waits. The ERs used to be, I think it was up to 2 days for that. Sometimes it's right now, luckily the numbers are going down. I think for the wait times, sometimes it's only like 4 hours max, but it's really, really hit and miss. But yeah, there's a lot of pet and not enough people.
Yeah, I would say the same thing. And it's not just in the US, it's all over the world that the demand is really outstripping the supply and the ability to get pets seen immediately. But it is getting better, and hopefully will continue to get better.
What's your least and most favorite animal to take care for?
Ooh, I can go first on that. I love kittens. Kittens are definitely my favorite. It is just so much fun to watch those young animals learn, explore, get to experience things for the first time. They can also be a little feisty, which I love, and can be just really, really fun. Oh, least favorite. Ooh. Birds for me, I never learned enough, I think, about how to handle birds, that I felt comfortable with those larger like parrots and things like that. I could handle the smaller parakeets, things like that, just fine. But once they got over like about, I don't know, 10 inches tall, I was not super comfortable with caring for them. So those were my least favorite. Nothing against birds. I just never learned enough that I felt comfortable.
I echo, my favorite is cats. I'm a big cat person. Obviously, I had 21 until Sunday fosters in my house. So we added on 5 more. So that's 26 fosters plus 5 of my own personal cats. So clearly I love cats a lot. So I would say those are my favorite. As far as my least favorite, that one's hard. So I like dogs. I have a dog. I have 2 dogs right now. But my least favorite are, in this preference, untrained dogs that come into the hospital that jump all over me. I just don't like getting knocked down, especially the big ones, or the aggressive dogs. I can read cat behavior, no problem, but some dogs, you can't tell until they're just really mad, and they kind of scare me in that sense. I had a parrot, so I'm pretty comfortable with doing some bird things. I don't treat sick birds because birds die, and you have to be really careful with them. So it's best left for the specialists. But aggressive dogs, I would say, are kind of my least favorite to work with. But that's why we have drugs, to kind of help relax them and calm them and help make it a less fearful visit for them. So there's ways to work around it. I don't know, I've been bit a few times and now I'm just a little bit gun shy.
Dr. Thompson, you mentioned that you're going to show us an X-ray and some kittens at your clinic.
Sure. Yeah. We're going to have to go on a little trip. So there's lots of things going on. Okay, so Dr. Mills I'm doing a Zoom with high school students. Oh, okay. Dr. Mills is here, and she is doing dental cleaning, and there's going to be some blood, but she's pulling teeth. I just pulled this dog's big broken canine tooth. So she just pulled that out of that hole right there. And while Dr. Mills is doing surgery here, this pet's getting fully monitored. And this is vet assistant Jenny, who went to Carrington and then has just learned and grown to be anesthesia monitoring. We have a wonderful CVT Katie here, who's working on inducing, it looks like, a mass removal. And over here we have Dr. Marr, who's doing a sterile procedure in the sterile suite. She's completely sterile. The dog's under anesthesia, getting fully monitored. And we have Mackenzie here, who went to Carrington as well and is a vet assistant. Sorry. And we have Jessie, who's a vet assistant doing a dental cleaning, monitoring her patient as well. And then on to X-rays. Oh, it looks like they commandeered the X-ray machine. Just gonna do that and hit pause. Last week. So last week I saw this kitty cat. Can you guys see this? Sorry.
Yes.
And this cat right here is sore. And so over here, this is, can you see I'll just use my finger. This right here is the hip, and you can see kind of a normal joint socket. So it's the ball and socket kind of, wait, I'm brain farting, I apologize. So this is the femoral head that fits into the pelvis. And then if you look at this side, it's this area right here is not nearly as attached. And so this is a condition young male cats get that's called femoral head necrosis. And unfortunately, you can't really do much short of removing this and putting in, like, doing a total hip replacement, or we did, where we just, so ignore this week, and it happened to this side. So now this cat needs surgery to remove the femoral head on the opposing side, which is just a very common young male cats. You can also kind of see it on this view, how we removed it on the right side. We're going to have to do it on the left. But this was before. Oh, it's not in focus. I'm sorry, guys. There we go. Before and then after. I was trying to find other fun X-rays, but there really aren't much. We have hospitalized pets, but right here, it's a little dark, but we have some little baby kittens. This one, I just woke up, and they're here with their mom. Mom's going to get spayed and then go back to her family. And then the kittens are going to come into rescue. And once they get big enough, they'll get adopted out and find homes too. And then we have a noisy neighbor, which is a husky or a Malamute, one of those. Should I show anything else?
I think that was a perfect tour.
We also have this back area. This is where the dogs are hanging out before surgery and telling us what's up. And then we separate. On this side, we have the cat area. And so we've got some kitties here. Their sheets tell us what they're here for. And then we have some bunnies. So we see a lot of rabbits as well. Oh, look at these. These guys are cute. I think they're here for spays and neuters. And we make sure everybody's labeled. Got a little sleepy friend here. Hello, Prairie. Hi. So the cat side's a little quieter than the dog side. And again, some bunnies.
Does it seem as if kitten season's a little early because of our wild warm weather earlier this year?
Oh my goodness, yes. I usually don't have as many kittens as I have right now.
Yeah, so a good fun fact, how many litters can a cat have in a year?
You know, I've seen that thing, and I don't remember.
I can't remember.
I think it's 3 or 4. This is our rooms. That's Drew, and then Sophie down there. And so we have exam rooms to do appointments in. That's my job today, so there's nothing going on here. Sorry. And then this is Carissa, who is amazing and does a whole bunch of doctor things for me, like calling back labs and stuff. And then, oh, this used to be a bank. So this is kind of cool. I live in the vault. And then this is a little bit of my disaster of a desk.
That's a really fun tour. Makes me want to get a kitty.
Well, yeah, we've got a ton of that. There's a lot already. We also, because of kitten season being early, but also because of COVID, people didn't get their stray cats. Well, people don't own stray cats, but the Feral Cat Coalition wasn't doing a whole lot, and also trap, neuter, and return. So a lot of pets didn't get vaccinated. So we're seeing a lot more of a contagious disease called feline distemper or panleukopenia. So that's kind of really sad. We're seeing a lot more of that and feline leukemia in the population. But we're saving the ones we can and working really hard at it.
So before we end our event today, what is your words of advice to students?
So I don't know if it's necessarily like a word of advice, but this is a great career. You could, like what I did, start as a receptionist, become a vet assistant, and become a veterinarian, or what Rachel did, the same, and then become a CVT, and then working at a headquarters, which is really awesome as well. So I think that there's so many different opportunities in this field, and we love what we do every day. It's definitely not for everyone, but come get some experience. Shoot us an email at my work or with Rachel. Mine is Vista Pet Hospital. Just go to our website. There's a general email, and then they'll be like, "Oh, that's Dr. Thompson. She's the one that always does the outreach," or things like that. Or if you want to come hang out with kittens and see what the rescue side of it is, I'm happy to help with experience with that. I've got lots of fosters. I have a 12-year-old foster that has adopted out, like, I think, I don't know, almost 100 kittens already this year for us. So it's a great career. Work hard, get that experience. Your vet that your family takes their pet to most likely would be willing to have you come shadow or watch and see what they do for a day. That's my first experience, was going for a ride with my veterinarian, because he was mixed animal. And so I got to follow him around. I still remember him for this day, and he remembers me. I was a kid. I went over there and I said, "Hi, Dr. Violet." And he was like, "Hey, I know you." And so it's just it's a great career. There's so many different jobs. And most of us are willing to have you come in with no experience, start you at the kennel help. And if you show that gumption that you want to do more, learn more, and then you can move up, and who knows where it'll take you.
Yeah, I completely agree. I think just start reaching out and get some exposure and see if it's something that you're interested in, and know that everyone's path is different, and some people like to are interested in becoming a veterinarian. Some people like the veterinary technician route. Some people want to go into management. They go into practice management. So there's so much that the veterinary industry has to offer, but I think it's great for people to get exposure before they commit to something with the years of schooling. So get in, volunteer, reach out to your shelters, rescues. It's another great way. But yeah, just start getting some experience and seeing if it's something that you're interested in.
All right. Thank you so much for being here today, for volunteering your time. It was such amazing experience to see little kittens and like surgery. There's a lot of surgery going on in that clinic.
Yes, there's a lot of us doctors doing it. We have 2 doctors back there doing it right now.
All right, I am going to turn off the recording